at some of these events we go to.
Yes, everybody loves Chris Matthews.
Everybody loves you, Chris.
Wherever we go.
Yes.
Let's talk about health care right now. Chris, obviously you saw the Washington Post poll. You put it up. You ask people, are they concerned that the health care plan is going to reduce quality, that's going to limit their use of doctors, going to increase the deficits? The numbers don't look good for the president and for health care reformers.
Look at this poll.
It sounds an awful lot to me, and I'm sure to you also, like 93 and 94. It's a very, very popular idea generally to reform health care, but boy, it sure is tough once you roll up your sleeves like President Obama's doing and actually try to dive into the system and change it.
Well, it's just a question of your values. Do you think we have to do it or not? And if we have to do it, we find a way to do it. If we don't have to do it, we don't do it. It's really a value judgment. And I think the people have made a value judgment in this country. They want to try to do it. Certainly it's going to be difficult to get people to realize that if you're 22 years old and healthy, you got to pay money for the people that are not 22 years old and healthy. You got to kick in. You have to have an individual mandate of some kind. Just like a driver who may be a fabulous driver has got to pay for the lousy drivers. It's just the way it is. We got to share the cost of health care in this country among the healthy and the unhealthy, the young and old. That's the first thing. And the president hasn't really sold us on that yet. These are obstacles ahead, but I believe that since Harry Truman, the Democrats have committed themselves to this. The Democrats won the election. They've got to deliver. They absolutely have to deliver. All this argument about the problems is important, but the bottom line is it has to get done. It's not whether we can do it, it's how we're going to have to do it. And I think the argument has to be rearranged from, gee whiz, it looks difficult, I guess we can't do it, to, we got to overcome this. And certainly this country's overcome the problem of getting a person on the moon. It's overcome the problem of DNA and genome and all kinds of health challenges we've faced, like polio. One of the things we're going to have to overcome is this financial situation of sharing the cost of health care. I think it means more medical schools, more dental schools. It means more general practitioners. Chris? It means we can't do it is right-wing thinking.
Okay.
And I think the country's past it.
That's one way to...
That is the way I look at it.
Hold on. I got to stop right there. Let's put up the Washington Post poll, Chris.
Yeah.
And I'm going to show you.
Polls are useful if you want to beat health care.
Hold on a second. I'm going to show you how many right-wingers there are in America.
No, I'm thinking the attitude of looking for reasons not to do it is a right-wing attitude. Sure, you're going to find problems.
Okay, but Chris...
Are all those people right-wingers?
Yeah. And
84% of Americans right-wingers?
There's no doubt there's going to be costs to doing it. It takes leadership to get it done.
Okay, Chris,
right.
The other day on the show you said that he doesn't get this through.
Do you want to get it done, Mika?
I would like to get it done effectively.
No, would you like to get it done?
I don't like the answer. Well, something has to be done. Let's just throw money at it.
No, do you want to get it done? I think the country has to make a decision.
Wait, no, hold on, Chris. No, wait a second.
I got it.
I just want to say this, though, Chris. You are sitting here telling us, unless the federal government steps in and takes over health care, the president's a loser, and you're a right-winger for being concerned that the federal government being involved in something may actually drive up costs. Chris, I think we need to have a little more of a nuanced conversation here. We don't all
have to agree to do it your way. Because this nuanced conversation has led to the defeat of health care ever since Harry Truman's administration. Okay. This kind of argument has been very successful at defeating health care, the kind you're having now.
So, great. Well, so what do you want to do, Chris? You want the federal government to take over health care? Do you think that's going to lower costs?
No, it's the way you go about it. If your value judgment is we're going to find a way to do this and we're going to overcome the obstacles, that's one way to look at it. The other way to look at it is let's find as many obstacles that we can celebrate so we can have an excuse not to do it.
Okay, but I guess the question I was going to ask from the get-go here is we've had a lot of money issues pushed through because catastrophe was coming. And why with health care on something that is so convoluted and so difficult to solve, why would we rush this? I mean, why is this president a loser if he doesn't do this right now?
Well, I believe he has to do health care this year, and I believe he has to begin the process. Whether it gets all done this year or not is really a question of how much can get done by October. I do know, watching the Reagan administration, the Johnson administration, the second Bush administration, if you're going to get something done in this country, you better get it done your first year. I just know that historically. Joe, you know that. If you're going to get it done, you got to get it done. It's just the way things work, because by next year, you've got a lot of Democrats worried about re-election. They don't get anything done. Look, I really do recognize that this is a psychological problem we've got to get past. If you recognize the value that no one's turned away at the ER, and once the country accepts we have a common belief that you don't get turned away when it comes to emergency health care, why would you turn a person away when it comes to just general health care necessities as they come along in life? Why would you say to a person you can't get your kid to the doctor? Why would you take a value judgment like that?
Chris, what do you think?
It seems to me if you work, you don't have health care.
Do you think the administration is willing to, by October, accept a piecemeal approach to health care?
No, I think they're going to have to make a tough cut. I think they've got to go with individual mandate. I don't think they're going to go.
Law? In other words, auto insurance works because the government has fulfilled their job, which is they know auto insurance works if everybody pays, so the premiums stay down and a few car accidents. They have abdicated their responsibility in health care by not enforcing a law that says everybody's got to buy health insurance to bring the numbers down.
We have rules like this. Like, I don't like them all. We have rules about health care. We have rules about you can't smoke in restaurants because it causes cancer.
It has nothing to do with it, but insurance only works, as you know, and you made the point before I did, if those who don't need it pay in.
Exactly.
Because if the only people buying health insurance are those with catastrophic illnesses, the cost of the insurance is $50,000 a person. And then if the government doesn't step forward and mandate 18-year-olds get insurance...
Our kids aren't going to like this. My kids aren't going to like it. And I tell you, Mika, the president's going to have to make this. He's going to have to make this decision. He's got to start selling the costs as well as the benefits of health care. And he has to start doing it. I don't think they're going to get to the point of taxing our health care benefits to pay for somebody else's. That's my own sense. We're not going to get there. That's not going to sell. This Wyden plan is not going to sell. But I do think the idea of an individual mandate. I mean, Nixon was for, by the way, an employer mandate back in the 70s, and Kennedy undercut it and it didn't get done. Nixon had a very strong plan. If you employ people, you got to give them health care, period. The Democrats sabotaged that. I think Nixon could have gotten it done back in the 70s if the Democrats had played ball with him. I think Kennedy could have gotten it done back in the, Clinton could have gotten it done if he went along with people like Cooper and made some adjustments with people like Moynihan and Dingell, but he didn't. I think the day of compromise has come. I think the day of putting this off has ended. We will get a health care bill in October because the people who want it will compromise, and the people who oppose it are going to get beaten. That's what I think is going to happen.
Yeah.
Wow. Okay.
And this pussyfooting around and looking at the costs, if you want to kill it, come up with this. We could have avoided World War II if we went to the cost factors ahead of time. We wouldn't have won World War II if we looked only at the costs.
You're exactly right, Chris. I mean, like the Bush administration over the past 8 years, they didn't pussyfoot around. They just wrote checks. Stimulus bill, they didn't pussyfoot around. They just wrote an $800 billion check.
Wall Street,
Barack Obama's budget didn't pussyfoot around. Record deficits for the next decade.
Well, Joe, it's values.
I mean, pussyfoot around.
Joe, it's right.
They
it's values.
Checks.
The value the Bush administration had.
They just wrote checks. Let's just do it. Just write checks without asking questions.
Let Chris speak.
No, we ask the questions. Chris. We look at the costs, and we get it done. Look, it seems to me that the right wing